welcome to the ICFJ Global Health Crisis Reporting Forum. My name is Paul Adepoju, and I'm thrilled to welcome you today to this webinar on the fight against health misinformation in Africa. If you are joining us from Zoom today, please submit your questions on the Zoom chat, which you'll find in the menu options below. And if you are watching from Facebook live stream, please post your questions in the comments below, and they'll be addressed at the end of the presentations. On today's webinar, like I earlier said, we'll be discussing the fight against health misinformation in Africa. And for a quick background, between Friday last week and today, two major different but highly connected events happened. We had the World Fact Checking Day on Friday, and yesterday we celebrated the World Health Day, which is also coinciding with the anniversary of the establishment of the World Health Organization. And why did I say these two events are well connected? In the context of what we have, well, the situation the world has found itself in since 2020, health information has been crucial in directing how people respond to situations around them, and who to trust. And we are no longer in the world of talking about whether there is evidence to fact check or to back something up. It's all about what the people can access and how it's going to influence their life actions. I personally realized the importance of and the severity of health misinformation around 2014, 2015, when Nigeria had an Ebola outbreak. And in one of the viral messages that was going out, somebody jokingly said, if you want to cure Ebola, just have your bath or drink water, salt water. And we laughed it off, but I was surprised to hear that several individuals across the country actually tried to drink. Some people actually drank salt water, and a number of people actually died, and a lot of others were hospitalized. We've seen these gravitating even in the current pandemic, and it's no longer an issue that we can just laugh off, but it's something that deserves to be taken seriously. And that's why experts at different levels are actually serious about this issue. And we are glad to have with us today two amazing and well-thorough journalists and fact-checkers that will be helping us out to better understand the concept and the severity and approaches towards fighting health misinformation in Africa. From the World Health Organization, we have Abdallah, who is the WHO Crisis Communication Officer for the African region. And Alim, thank you for joining us today. How are you doing today?
Thank you so much, Paul. It's great to be here. Thank you for having me.
So we also have Lois Ubede, who is a Nigerian researcher for Dubara. And Dubara is a major fact-checking organization here in Nigeria and also has influence across the African continent. How are you doing today, Lois?
I'm very fine, thank you.
Yeah, so like I said, you can start putting your questions in the Zoom chat, and of course under the Facebook live stream. And before we go into the full panel discussion, we are going to have a background check, a background information on the various approaches on the fight against health misinformation in Africa. And Halim will be laying the groundwork before our full-fledged discussion. So Halim, we are really glad to have you today, and we would like to take your presentation first. I hope that's okay.
Brilliant, thank you so much. I hope everyone can see my screen. So I will start talking about the work that we're doing as WHO in the African region with all the different partners to fight the COVID-19 infodemic. So as you can see, we started something called the Africa Infodemic Response Alliance. That's a WHO coordinated network to fight health misinformation and information gaps in the region. It includes a number of members and participating entities, including the health organizations or health authorities such as Africa CDC, IFRC, UNICEF, UN Global Pulse, UN Verified, UNESCO, and Gavi, the Vaccine Alliance, and of course WHO. And we're very proud to be joining forces with Africa's fact-checking organizations like Dubaba, Africa Check, AFP Fact Check, PESA Check, Ghana Fact, and Medan. The goals of the Alliance are very straightforward. We would like to we are working on coordinating the response to the COVID-19 infodemic, boosting infodemic research, strengthening citizens' resilience to mis and disinformation, supporting and working with media partners to effectively share life-saving information around COVID-19 and to debunk misinformation and disinformation on any health issues, encouraging proactive disclosure by data holders, and through the early identification of mis and disinformation trends and provide a timely and strategic response at country level. The work that we're doing mainly focuses or applies the Infodemic management framework. That's a framework that was developed by WHO last year, along with 1,300 experts. And this framework is divided into 4 main pillars, which is identifying the misinformation and the information gaps, simplifying the technical knowledge, and amplifying it strategically through the correct mediums and channels, and quantifying the impact of the work that's we defined the work stream for the work of IRA, or the African Infodemic Response Alliance, into different work streams, which is coordination, advocacy, research, country support, and viral. And we're very happy to say that we have launched Viral Facts with all the IRA partners last Tuesday on March 30th. And it's a social media response and an intervention to disrupt health, especially around COVID-19. And the idea here is to make it visual, more visually and engaging and shareable and easy to digest. We have developed a number of fact-checking canvas, something that we call a fact-checking canvas, where these are a set of templates to make it easy to edit and update and tailor our content to be able to respond to. So far, we have has been this debunk in collaboration with Africa Check, where we debunked visualized through this video their debunk around the claim that COVID-19 doesn't spread in warm areas, and it has been viewed more than 8 million times and had received more than 500,000 interactions. We produce a series of different versions of the content that we have, the different formats and templates, and one of the successful templates is this one with the conversational WhatsApp, and we produce it in different languages. It's very easy to edit those templates to make sure that it's available in different languages. One way that we're focused on is to make sure that the content reaches, that the Viral Facts content amplifies the different fact checks that are being done and the content that we are producing. So we're collaborating or starting something called the Viral Fact. We started something called the Viral Facts Super Spreaders. And this is basically a network of healthcare, frontline workers, journalists, celebrities, fact checkers, community leaders, academics, and students that would participate with us and support the work that we're doing. It could be, the participation could vary based on people's interests. So it could be sharing and amplifying scientifically verified content that we are producing through Viral Facts and through the IRA partners, co-designing the work that we're doing, the products, the information products that we're doing, or just give feedback on whether it's effective or not. So it's very simple: stop viral rumors and share viral facts. And I will stop here.
So thank you very much, Alim, for that introduction, and thanks for sharing what the WHO and its partners are doing towards addressing health misinformation. So before I come back to you, before I ask you my first question, I would like Lois to actually give us an overview of what our organization does and her personal experience working as a fact checker in Nigeria, and of course, looking at it from the African perspective. So how does DUBUA operate, and how do you perform your function as a fact checker?
Thank you very much, Paul. DUBUA is an independent fact-checking organization in Nigeria. a project of Premium Time Center for Investigative Journalism. So we basically look out for claims and misinformation and debunk them. And we also try to create content in different forms. Articles, we have videos, text-based videos, and we recently started human-based videos just to get our audience to interact and share more of our content. Because we noticed a lot of people in Nigeria don't like to read. So when we make checks, written checks, we convert them to videos, shorter videos that explains like a summary of what the check contains and the rumor or claim it is debunking. So working with Dubawa has been fun. My background as a reporter with Premium Times before joining Dubawa helped a little, but I discovered it was a whole different ballgame on its own. And it's been a learning process and a fun one. It's something that gives you some sense of responsibility and achievement that you can actually do this and help people get solid information and make better decisions.
Yeah, so thank you for that. Then, so for Alim, WHO itself is a very big organization. It's very robust and powerful and influential. And but from your presentation, it looks as if the organization is making a clarion call to others to come and help it in fighting health misinformation. So why is an organization as big as WHO unable to combat and win the battle against misinformation of its own?
I think the infodemics and misinformation in general, it has been there since the beginning of any public health crisis, since the beginning of time. It's the situation that we're seeing today is really unprecedented because we have the first pandemic in history that is happening in the age of social media. And the situation at the moment shows that, I mean, according to UN Global Pulse research, we're seeing since the beginning of, or since the onset of the pandemic in February, since it hit the region, we've viewed over 230 billion times content around COVID-19. And that's happening mostly on conversations happening mostly on Twitter and web-based news articles that's until March. And this is just in the 47 countries within the WHO Afro region, which is mostly sub-Saharan Africa, with the exception of the Sahel region and plus Algeria. So the work that we're seeing here, the need to address this issue is huge, because infodemics is not just about misinformation, it's also about the influx of information. You have too much information flowing and there's a lot of uncertainty, things are happening at the same time, and conflicting reports, etc. So the work here is, and the necessity to address this problem is huge, because as you can see, people need to make decisions related to their health. So and there are risky behaviors that could be come as a result of what's going on on social media and different work like that. So I think the urgency here shows that there's a need to have a whole of society approach to address this issue. WHO as the intergovernmental and multilateral organization leading on public health globally really has the responsibility to kind of mobilize and make sure that we ring the alarm bell towards this crisis. So the work that we're doing here cannot be done individually through WHO. It needs to happen through collaboration and having the working with, in terms of making sure that the correct messages reach out and the debunks and the correct information and the corrections are there. So to enable people to make the decisions that would not pose any risk to their health. And this is happening in collaboration, of course, with partners like Dubawa and the other fact-checking organizations. And it would not be feasible to have this through one way. It just needs to happen through a collective and through collaboration.
Yeah, so for Lois, I'd like to know what you think is peculiar about health misinformation in Africa compared with the rest of the world. So what is unique about Africa's battle with health misinformation?
I think from our side, we can see that misinformation, I mean, there are clear countries that have better high internet penetration because of their population, because of their considered media hubs like Nigeria, Kenya, South Africa, in Anglophone Africa, that are really leading the discourse around COVID-19 vaccines. And when misinformation hits those countries, it really spills over. Or we can see a lot of misinformation coming from the global north, coming from anti-vax groups in the US, in France, in other places in Europe, in the UK, etc. These kind of, in our region, we also have our own concerns. We have a lot of, there's authorities, there is people who are worried and just don't think that there's an overreaction towards what we're seeing. So it's really not peculiar in what we're seeing globally, but the trends in the region are mainly, I think the most interesting ones is that there is a lot of interaction with the global anti-vax movement. It's much less organized in the region, but it really does resonate here. And I think Lewis can definitely share a couple of examples of similar content and similar ideas.
Oh, thank you, Halim. For me, I think what's peculiar for us in Africa and health and misinformation is the fact that our health system is one which has never been really stable, and access to these facilities are not so strong. And even health information bodies and agencies that are in charge of this information, that are supposed to put out the right information, do not do this on a regular basis. So there's a gap for people to manipulate information and put out the wrong thing out there. I also feel superstition and myths, which is a thing for Africans, is something that has also fueled misinformation in Africa. A lot of times we believe, oh, this does this, or this cannot be possible because of this. And we have seen, I believe also in herbal care has made us to relegate the need to actually look at vaccines and certain medications when they come out. And then because of the health system we have in Nigeria and the distrust between the public and the health officials, people don't even believe or trust whatever comes from health authorities. We always feel like there's an ulterior motive to whatever is being put forward by the government or health authorities. I also think that the issue of the internet is something that has generally, this is not peculiar to Africa, has increased the flow of misinformation, and especially social media. A lot of people now turn to social media, seeing the gap that has been created by lack of information from health authorities, turn to social media to find cures, to ask questions about their health. And this is giving a lot of people a chance to actually manipulate information.
So thank you, Lois. Now, so it's obvious that access to communication, access to technology, which were initially intended to ensure that people can quickly and easily access verifiable information, has also opened the floodgates for misinformation. So for Halim, what do you think is the ideal way to quickly ensure that access to verifiable and accurate health information in Africa is achieved without contravening human rights and access to free expression?
Thank you for this question, Paul. I think one thing that we really need to acknowledge is that misinformation is traveling through networks. And there's this there's a recent study from the University of Cape Town that mentioned that people in Kenya and Nigeria, they investigated the reasons why people share misinformation, and actually people share information in general because out of concern and a sense of civic duty. So we want to capitalize on that and direct people in the right direction and make sure that we sincerely, as health authorities and organizations and and media and governments, we need to sincerely acknowledge their concerns and listen to what they're worried about, and be transparent and share correct information in a timely manner. And in a time that is uncertain, like the one that we're living in, we need to also be very clear on what we do not know, and the gaps in our knowledge, in the research, and in that science is a process. It's not an obsolete. So that, with all of that in mind, it's quite important that and that's the thing that we're trying to do with the IRA, the African Infodemic Response Alliance at Viral Facts, is that we want to build a network of people who are willing to spread correct information and share it with their peers, with their families and friends, to be able to kind of capitalize on this part of this sense of civic duty. And what we recommend is that to all the governments that we're working with and to all our partners, is that we, by shutting up different voices of concern who are shedding light on certain concerns and stuff, it would amplify misinformation. It would not actually come in handy to that. So it's something that we really need to make sure that that with censorship we amplify the problem. We need to be careful with that, and to make sure that we increase the volume of correct information and increase the engagement of that, and make sure that it's accessible to everybody. I see one of the questions actually is asking about accessibility, and how can we make sure that the information reaches everyone in different languages. And that's an excellent point, because we need to make sure that we are reaching the people who are more vulnerable to be impacted by the infodemic. And these people, mostly, they don't have access to the internet. And these people mostly if they do, they have limited data. And the infodemic and the misinformation spills over from the online realm to the offline realm. So it's really important to kind of acknowledge these things. One of the things that we're trying to do is to make sure that we collaborate across the different priority countries that are spilling over misinformation. When it reaches them, it's amplified. And we make sure that we have local languages. It's definitely one of the things that we have in our plans. We're also conscious that we're producing content that sometimes might be a bit heavy in terms of videos and stuff like that. So we hope to we're thinking, and we're hoping to work in that direction, where we're able to produce more lighter content that's lighter on data, light on data, and can influence that. And again, like working, and I'm sure Dubawa and Louis can shed some light on their experience on that as well.
Yeah, so for Louis, I really want you to start your own contribution with what are the most popular nature of health misinformation that your organization is helping to fact check. Then I also wanted to add to your response, Louise, the issue of conflicting reports from different sources that are expected to be authoritative. And how do you think this issue can actually be navigated so that we don't just take sides and the reports that we are putting out, that journalists are putting out, because journalists are not the origins of scientific reports. They are also accessing these reports from experts. So when we have conflicting reports from different sources that are expected to be authoritative, how should journalists navigate this conundrum?
Thank you very much, Paul. I'll speak to the kind of misinformation we have come across first. One major thing I think spreads misinformation in our region and in this part is social media. And I think WhatsApp and Twitter has been like a major influencer of false information. I think WhatsApp has like a higher rate of spreading this, and I also want us to understand that the spread of misinformation is not just in the younger generation. There's also an unconscious spread of misinformation by the older generation, because we have this forwarders receive messages that our parents send out, our uncles, send out, send to your child, send to your family members, if it's to save a life and all of that. So that has been a major influence on misinformation. And also Twitter, they love people who are self-acclaimed health influencers and all of that. Even politicians are also part of the problem. So I think we should also look at that. And aside the internet, like you rightly mentioned, there are other sources of misinformation. I could even say there are people who do not have access to the internet, but still get this misinformation. I feel misinformation spreads in different forms. While there are people who have access to the internet, those who do not have access to the internet, they have access to radio, they have access to opinion leaders like their traditional rulers, their religious rulers who give them information and they take it as the truth without questioning it. So I think these are people we need to reach out to educate, to enlighten, so they can consciously watch this information that they share out. While we focus on the internet, there are other sources that we should focus on. Then your second question about conflicting reports. I think that brings us to the point of being transparent about our process, because, and while we are not total authorities for sources of information, because we rely on health experts and organizations who are out in the field there and have better information, we should be humble enough, permit me to use that for lack of better words, to actually acknowledge when we do not have all the information. Because there are reports where, okay, now health information is not just, health misinformation is not just misinformation in general. Health misinformation changes. What is true and what is false in the health sector actually changes because of studies, new research. So it's dynamic, and you need to make this clear to your readers so they don't feel like, oh, you came here to say this last year, that this was the fact, and then this year the facts are different. So when we have, for example, like the coronavirus, when we have stuff like this that go out, you need to be clear, okay, this is a new virus and there's still studies going on. These facts I'm presenting to you right now might change, but this is what we have now and all that. So if we are transparent about our process, it will help us get across to our readers better and not portray ourselves as know it all.
Yeah, so thank you very much. So before I go back to Aline, I still want to, this question is still for Lois. So what is your process like? Let's say I wake up today, you wake up today and on social media, somebody is saying that hot coffee prevents COVID-19. So what is the process like for you to verify that?
Okay, for us at Dubois, there are various ways of coming across claims. We have a WhatsApp platform where we allow people drop claims for us to fact check. They want us to fact check. We go through social media, we go through traditional media, because one other trend we have seen is misleading headlines, where your headline is different from what is in the content. So we don't just focus on the internet, we also go through traditional news media. And then we go through broadcast programs that feature politicians and major influencers in the countries, because they make certain claims on those platforms that are recirculated on social media and mislead a lot of people. So for example, like drinking hot coffee does this. First of all, you want to look at the claim itself, because you need to read and understand the context in which they're circulating this claim. And then you now do like a basic research before you even try researching or verifying the claim. Do a basic research. What is hot coffee and what's this thing they said it prevents? Have a basic knowledge of both. Then you now try to see there's a relationship between drinking hot coffee and that, it's said to actually prevent. Then you can actually reach out to health experts to speak to them. You can try to find studies, researches online. Sometimes, most times, you don't get studies. So you rely heavily on health experts who would speak to from their experiences and probably cases they have come across, and then give you better information.
Yeah, thank you. So Halim, in the fight against misinformation, I remember major tech giants introduced a lot of tools. For instance, if you're putting up a picture on Instagram that even has anything to do with COVID-19, a link will be below your post, showing that you have to click this to get more information on that condition. But and then if you look at what has actually been happening to on Twitter, in which there was a directive, there was an intentional measure action to actually address misinformation. I think it has really led to uh, those that are actually relying on these misinformation to think there is a conscious effort to actually censor their voice. So how do we, from your perspective, how do you see us tackling health misinformation without giving the impression of censorship in regard, especially looking at how the tech companies have been addressing this issue?
Well, I think so. Basically, when we start, during the onset of the pandemic, we started at a global level. WHO started engaging with Facebook and Twitter and all the tech companies, Google, etc., to kind of make sure that these disclaimers are in place. There is and through and maybe I think also Lewis can share the experience was because they are considered a third-party fact checker with Facebook. But the experience here is not about censoring people. It's about making sure that the correct information is there. And the work that we're doing mostly focuses around making sure that the information, the correct guidance, and the scientifically focused and checked guidance is available in as many places as possible. So people would be able to kind of remember always that the different social media, the different measures to kind of, when it comes to masking up or social distancing, et cetera, et cetera. So from our side, I feel that we are trying as much as possible to encourage the proactive sharing. That's our strategy, that we're trying to proactively share the correct information and to make sure that it's easily accessible and available in as many languages as possible, in as many mediums as possible. But it's not, the strategy here is not focused on quelling other voices, etc. But on the other side, it's making sure that the correct information is as accessible as possible.
Lois, do you want to add to that?
Although we want to attack the idea of censorship and all of that, we know censorship is going to be like a clamp down on a lot of sources of information, but I think there would be some level of censorship if you want this to work, not a total clamp down of the media on people, because understand where there's no law, there's no abuse of law. So I feel like it's not really, the idea or the goal is not to clamp down on people, but to be able to highlight or note things that probably I make a post on Facebook, the tech company should be able to say, okay, this is suspicious or this contains misinformation, and draw the attention of people to it. And then people will read further and then get it better. Or organizations like us can pick it up and probably do a media literacy article on it or do like a fact check on it so people get to better understand certain things.
So, Aline, the video that is showed us has like one of the highest views. That's like 8 million. That's across Africa. But if you agree with me, there are health misinformation clips that have 100 times higher views than that, and they're circulating globally. And so why do you think true information still struggle to go viral compared with health misinformation? How can this be addressed?
You just asked a question that's our raison d'etre, simply. Why did we start? That's as if you're asking us, why did we start Viral Facts? And the Facebook, the misinformation that is going viral mainly goes viral because it's emotive, because it triggers us, whether anger, fear, resentment, and all of that, these kind of emotions. And it's very simple. It's just a screenshot or like a very simple meme or stuff like that. What we've been struggling with is the packaging of the correct information, and having, for example, like a long article about the benefits of vaccines vis-a-vis one photo that shows Bill Gates with a big needle and he's gonna, do something. It just doesn't compare. You can't compare apples and oranges. So what we're trying to do with viral facts is to try and make sure that we produce and package the correct information in a way that could compete with the misinformation. And again, like in terms of the formats, we're also very conscious to make sure that it's happening through the truth sandwich and through different formats that does not amplify and does not stress on the misinformation. So we don't give oxygen to the misinformation, especially on social media. And as a platform, like, and through the different organizations that we're partnering with, we can see that we would like to make sure that the content travels beyond the people and the usual suspects, the people who already know about WHO and trust WHO and Dubois and Africa Check and others. But on the contrary, we would like to make sure that we create content that will go viral and beyond to people who are still undecided or don't know and on the fence in terms of these things. It's not an easy task, but as I said, like in the beginning, it's a networked approach. We need to make sure that we engage with different networks, make sure that we need to collaborate with the media, and the media has an important role, and journalists have a great role to play in this across mediums, not just written or TV, written or websites and news websites, but also TV and radio, and to think about creative ways to kind of translate the correct information and the debunks of misinformation to be able to do it. But ideally, and I just want to add that we shouldn't wait for because when the misinformation goes viral, the problem has already happened. What we're trying to do is to make sure that we can anticipate the waves or the questions or the concerns early on. And we've been working with our fact-checking partners to be able to brief them ahead of time. We tell them, we organize briefings ahead of time, ahead of specific events that we know that could stir misinformation, that could stir concerns, and we break down the technical knowledge, which could fit into hours of technical presentations because they would help us. They are our ambassadors to help us translate and make sure that the correct information is out there. And the messenger here is very important as well, to make sure that we are working with trusted messengers to be able to share this information in a timely manner and through trusted sources. So that's also another thing that we need to do. But generally, I think it's a question that everybody's struggling with. No, we are just trying our best to find an answer to through this initiative.
So please, if you have any question for our panelists, please put it in the Q&A or under the live stream video, and we are going to take the questions in between these conversations. I'm already integrating many of the questions that we have into my questions already. And Lois, I would still like you to comment on how facts can actually go viral. And the reason is this: many of these, a significant number of these misinformation is actually coming from many gatekeepers. For instance, one of the reasons why a story health misinformation like that connects the 5G to COVID-19 in Nigeria was because a popular church leader actually went on live TV and told millions of his followers that this is happening. And those millions of followers are already expected to be watching that event live. So at a go, it reached millions of people. And so look at, considering what health communication experts like Halim and fact checkers like you, Lois, are going to be dealing with, is there any hope? How can we potentially surpass and be ahead of health misinformers?
Okay, I think it's just going to be a continuous conscious effort that we have to make. But saying this is clearly how we're going to overcome or be ahead, no one has actually clearly identified that. But like he said, going ahead, sometimes even when you don't have claims, sometimes questions people ask you or questions you come across and discussions on social media platforms can make you do an explainer or a media literacy article to explain things even before people begin to twist them and spread false information. So I think that is what we'll continue to do, and then try to create content that are attractive. In Africa here, we know our reading culture is really poor. So we could make use of social media content, skits, comedy skits that carry certain information. We can make use of social media apps that people use a lot, something like TikTok. We can make short, snappy videos that people can share. We can make memes too that have details of your fact check, because not everybody has the time to read 5 minutes, 10 minutes, 20 minutes long article. So you could make memes, something like, we do something similar in Dubawa. We have fact cards. When we do a check, a long check, we create like a short poster or meme with the picture of whoever the claimant was or whatever the issue is, and then just a short verdict on what this claim is. And then, so that would help people to circulate and assimilate what the facts we are pushing out, as much as they are circulating and accepting the misinformation that is out there. And then we also have to look at languages, like you said. Sometimes we get videos and voice notes or clips, and then you go ahead and do a check in English. And then you are spreading it to people who have access to the internet and who understand English. Now, where the misinformation is spreading, you have not done anything. So we can try to look at how to transcribe, even if you do the check in English, transcribe it into local languages, especially the language in which that voice note or video had originated from. So we are trying to do fact checks now in Hausa. We're looking at other languages, Kanuri, Yoruba, and all of that. And this will help people who do not have access to internet, who do not have time to read long English, actually can listen or watch. And we're also doing videos. I said I have videos in English. We are working to do videos in other languages so that everyone is reached, just the way misinformation is spreading to everyone in different forms.
So for Halim, what is currently the most effective way, at least in the short term, in WHO and its partners effort towards addressing misinformation? What do you think has been the most effective way towards addressing this issue so far?
I think we need to acknowledge the fact that the study of infodemics is a new field. There's still a lot of gaps and a lot of research questions that are unanswered. And that's why one of the key work streams that we're focusing on as IRA, as the African Infodemic Response Alliance, is improving infodemic research. For the time being, we can see a number of examples of content that are really that is traveling and going different places. We can see from the viral facts content that we're producing that when it's happening, when we produce, when we share the content in a timely manner, and for example, we just produced during the AstraZeneca, during the AstraZeneca and the EMA announcements, we have been producing it within a week of the to respond to the claims and to the concerns, and to kind of make sure that we share things with the public in a real-time manner and in an engaging format, and trying to listen and to have more of a conversational attitude towards the community. And here it's quite important to highlight that the community in the traditional public health communications never included online communities. Today with Infodemics, we really need to acknowledge and address the concerns of the online community. So in general, I think it's quite important to ensure and to continue in having more conversations with our audience, and to make sure that we're engaging with them and with their concerns, acknowledging them. And the acknowledgement aspect is quite important, because it's all about empathy, and you cannot make your message come across if there is no sense of empathy. You cannot just give the cold facts and that's it. And that's also one of the weaknesses of our weaknesses in terms of our communications. That it's just pure facts, very little emotions. So making sure that there is this empathy into it, and there's this care. We want people to make decisions that would not pose a risk to their lives, etc. So again, very humbly, I would say that there's still a lot to learn from our experiments. We're literally building the ship as we're sailing it. So it's something that's happening on an ongoing process, but we know that best practices from the work that we're doing is being more conversational, focusing on making the engaging content, understanding our audience, and making sure that it's accessible as accessible as possible. And we're seeing that because the misinformation keeps on repeating itself, we can see something popping up in one country and then disappearing and coming up again in a different country. So having evergreen content when it comes to debunks and making sure that it's delivered and shared all over is something that's quite important. And in order to be able to address the persisting kind of narratives and concerns.
Yeah, so like you said, I can see I have a lot of questions on my own, in addition to what our members are actually doing. So before I come back to my own lots of questions that I still have for the two of you, I want us to take this question from Silas Jonathan, and which talks about, we've talked about how enormous this problem is. But again, we should also take time to focus on the good stories, the good outcomes of fact-checking, and what has been done so far. So what is the impact and positive results registered so far in the fight against health misinformation? So I want specific instances. So I would like to start with Louise.
Okay, thank you very much, Paul. Okay, so some of our stories, our works, our fact checks have generated prompt and great response from policymakers and all of that. And going into partnership with health agencies and authorities like NTDC. So sometimes we are called to the table to speak and share ideas on how they can better address these issues. And we also are trying to work on organizations like the National Orientation Agency to train them and get them to do other things. So one major thing I've seen is people getting to take down their posts, delete posts. People get to, okay, no, this person or this page is known for this. So when information comes from them, people don't spread them as much as they used to spread them. So I think that's like a major impact for us.
So Halim, any good story, any positive story so far to share?
I think the AstraZeneca one would be one example that we were very proud of. I think our content, and we tried to use the story format on Facebook and Instagram to make sure, and the WhatsApp status. And again, with the network that we built and the alliance that we've built, we were able to kind of make sure that the message goes wide and clear. And we even have seen content around vaccines. And by the way, the content that we're producing today, 50% of it is about vaccines, because the claims and the concerns are mostly driven by the conversation around vaccines and COVID-19 vaccines. So this is one of the successes that we would consider, because we managed to, within a very short period of time, to make sure that the content is ready, cleared, fact-checked, and going all over the internet on Facebook and Twitter and WhatsApp. I think one of the things that we kind of that are concerning, I'm just gonna take it the other side. The things that are concerning that we are starting to see is that there are the bots, online bots that are on Twitter, that are starting to target the content and trolls and all of that. And that's something that I'm sure the fact-checking organizations have been struggling with since they've started. But that's also a real red flag, because it just shows that the conversation and the misinformation that is spreading is not just coming from genuine concerns of concerned citizens, but it's also automated, and it's part of a bigger disinformation effort to impact the discourse around vaccines and around COVID-19 on the continent.
Yeah, so before I ask for what you still think needs to be done to improve the impact of efforts towards addressing health misinformation, I'd like us to take this question from Martha from Facebook. And Martha is asking, why do people tend to trust fake news instead of journalistic content? And is that media fault in terms of way of communication? So let me start with Lois. So why do you think people still trust fake news instead of journalistic content?
Okay, I think this depends on a number of factors. Who is sharing it? What are they saying? Sometimes people accept false information when it resonates with their existing sentiment or beliefs. And then probably whoever is sharing this is someone who they look up to, who they trust, or they've gotten factual information from in the past. So most times it's not a one factor thing. So you can't say this is why. But I also know journalists, the trend we have seen with reports having misleading headlines and all of that is also affecting how the public consume media content. And they feel like, okay, if we are saying people on the internet are sharing misinformation, and then we have news reports from journalists, credible journalists, misleading the public, who do we now trust? So this is also part of the problem. So I feel like journalists should make sure or work towards or avoid using headlines just to get traffic, just to get readers or followers. And if this story says this, that should be your headline. There's no point trying to attract readers.
Salim, do you have anything to add?
Yeah, I think there is a sense of confirmation bias when people receive the information from their friends and there is something wrong or a piece of misinformation, it's much easier to believe. And again, as we mentioned earlier, it could be emotive, it could be something that triggers a specific emotion and outrage or fear, and that gets people to kind of believe something because it's plays on that. So I think when it comes to the role of the media, again, like as those mentioned, everybody makes mistakes. Health authorities make mistakes. The media and journalists sometimes make mistakes. But again, like transparently and trying to shed light on the importance of the correct information and acknowledging transparently is something that's quite important. I think that our role in general needs to focus around making sure that the material and the content that we're producing is relatable, is timely, and there is one opinion. So if there is a specific piece of misinformation that is circulating, making sure that the correct information and the rebuttal is there. And sometimes we just need to hammer on the same message. So for me, the COVID doesn't exist, or COVID is a rich man's problem or a white person's problem. These are all things that we have been seeing since day one. And just like convincing people otherwise and hammering down the same message needs to just happen in more innovative ways. We just need to say the same thing, but in more innovative ways. And I think there is a structural issue with the media. I mean, media organizations are struggling with, especially during the time of COVID, with limited resources, with different financial constraints, and they don't have the different capacity to kind of innovate as much as they want. So that's why we're trying to, with this initiative and with Viral Facts Africa, we're trying as much as possible to collaborate and to provide the information and the experts and the animations and the designs as readily as possible for the media to be able to hammer down on these messages in more innovative ways, in different formats and through different mediums.
So I also want you to talk on how journalists in countries where there seems to be state-sponsored health misinformation, how are they going to carry out their works of properly and adequately informing the public regarding COVID-19? So let me start with Lois. Lois, do you want to take on that question before we take it to Halim?
Okay, I think journalists in countries where they're state-sponsored misinformation, I think while there are claims or checks where you have to rely on government sources, if this is had this misinformation generated from a government source or a government authority, I think you should, as much as possible, avoid just making conclusion or a verdict based on what they will give you. But this does not mean you would just avoid them or not make this for balance. You would want to look at both sides, because sometimes they make statements, and when you reach out to them, they tell you, oh, they were misquoted or was taken out of context and all of that. So I feel we as journalists should do due diligence and still reach out to them and hear. And sometimes they still confirm or verify that statement or that claim was made by them. Then it is now your duty as a journalist to actually try and look at other information or source of information and how you can bring, even if you can't say this is true or false, try and enlighten the public. Oh, these are the facts on ground, and this is what we have.
Alan, I was thinking you would go right after.
I think when there is, I believe that the work that is being done by the media organizations to dispel any misinformation is crucial. At the same time, when we have certain government officials or certain politicians who are sharing or amplifying concerns or misinformation, it's important to correct them. And what we do, the media organizations and the fact-checking organizations, they take care of that. And we as WHO, and all the health partners organizations, we continue to share the correct information, and we say that this is our position. We try as much as possible to advocate for a change, for an official change in the government's position or in the politician's position. So what we try to do is to organize these, to work on advocacy, to advocate for changing or addressing concerns, because some of them are also, because they're also serious, whether about different things, and making sure that there is communication and these questions are answered is something that we try to do as much as possible. So I think there is always a need to make sure that we call on our audiences and our the general public to focus on double checking and triple checking the information, to avoid false statements that, as Lewis has mentioned, and to also, if one position, just cross-checking and checking other positions from other health organizations and from other media experts. Just corroboration, double checking, and triple checking is key here. And unfortunately, this is something that comes out of the. It's not everybody's job, or not everybody as a general public. Not everybody has the attention span to kind of double check and triple check and investigate something. And that's why we always say, like, we have the fact checkers. The fact checkers are doing that for you. You can check the fact organization website, or you can go check the trusted sources, like or the international organizations, to kind of make sure that we're all on the same page and see and make a decision for yourself.
So for journalists that do not have a core science background or core background in public health, and anytime there is something that is new, journalists are always there to report it. So how do they deal with the conundrum of reporting health misinformation. Are we saying that they should not mention it at all, or are we saying they should report it and respond to it? Well, because if they are reporting and responding to it, they are still adding credence, some credence to the health misinformation. So how can health journalists, how can they deal with the conundrum of adding credence to health misinformation? So Lois.
Okay, thank you. I think basically to address that, every health journalist, whether you have a background in health or not, should have a basic information, basic knowledge on any issue before writing about it. There are things we hear daily, and you're like, even you as a journalist, in fact, you're like, oh, I never knew this before. So I feel like if you come across something, don't just jump into it with what you feel you know. There should be like a basic research over and over again, not just from 1, 2, 3 sources. And then health experts are your friends. I think you should have like a call log for contacts, and you can reach out to people who can share those kind of things with you. You can also look out for people who have been victims or have experienced, just to put like human voices into your story and have enough context. And then where you cannot lay your hands on quality materials or literature, I think you should be open enough to say, okay, these are the efforts we have made, but so far this is what we have been able to come up with. So I don't think because I do not have a background in health, I should ignore something and allow it to spread. The best I can do is take time, extra time to study, to read journals, to read literatures on it, to speak to experts who can further break this down and explain things to us. Because I can remember a check I did on Moderna having 100% effectiveness against severe COVID-19. The first thing that came to my mind when I saw the claim was, okay, I know there's COVID-19. What do you mean by severe COVID-19? Are there varying degrees of COVID-19 and all of that? And I had to read, and I got to understand they are different. There's a mild, there's a moderate, there's the critical, and all of that. And then I know there are people like that out there, readers, who are also having the same questions in their mind. Or people would just assume, oh, they're saying this vaccine is 100% effective against all kinds of COVID-19 vaccines. So when you read more, you have a better context to explain the facts to your readers.
I would have loved Halim to add to that, but our time is fast spent. So I have 2 more questions for the 2 of you. So Halim, what resources, what fact-checking resources can you share with our journalists? And that also goes to Lois, you're a fact checker. So what tips or what tools can you share with our journalists? So while Halim is speaking, Lois, you can be putting your own in the chat button, chat box. So Halim.
I think I would start by saying, please follow Viral Facts Africa, follow all the fact-checking organizations. We would love to coordinate and work with all journalists if they have any questions, to give them access to different experts and to support with debunking any, dispelling any misinformation. So Viral Facts Africa is available on Twitter, Facebook, Instagram. We also have a sign-up form to receive a newsletter with the new content that we develop. And we can also, we're happy to give, our content is under Creative Commons licensing, so anybody can use it as long as they attribute us. The work that we have a big content hub in different languages, in English and French. We're hoping to add more languages and working on adding more languages. So we can give access to journalists who would be interested to kind of using viral facts content, whether to amplify it or integrate it in their stories, or share or actually co-design that content and these debunks with us. So yeah.
I'll just speak to what I was actually typing. So there are tools. I dropped some tools for images, tools for videos, and then even for images and text. I think one basic thing we can do as an ordinary public who does not have like fact-checking knowledge is to be observant, because some of this misinformation that's spread on WhatsApp, short memes and all of that, you see errors or grammatical errors that actually raise up red flags. So this is poorly constructed. This cannot come from an authoritative source if it is like this. And then we should also look at images. You can look at signboards in the background and all of that. So when you're observant, you can tell when something is fishy, even if you cannot say it is right or wrong. So aside these tools, because most people would not have a lot of time to go through these tools, some of these tools you need to spend time with them to get to understand how they work and how they can help you and find a way around them. So little tips like this can help you when you come across information to actually, and then just a simple keyword search can actually help you find out if something is actually true, if there are other reports from credible sources on the net and all of that.
So my last question to the two of you is, so starting with Halim, what do you think still needs to happen to win the war against health misinformation? Because I still think there is still no major punishment or retribution for individuals that are sharing this health misinformation. So to achieve the set goals of for which you are focused on in this context. So what do you think still needs to happen? And I think this can also be inspiration, story inspiration for our journalists. So Halim.
I think there's there is necessity that we work together. I think that's always. I mean, it's always easy to say let's work together, but then it's really hard work to have a whole society approach towards this problem. We really need to kind of make sure that we proactively share the correct information. We collaborate in fact checking. We collaborate in addressing and identifying the concerns. The collaboration here is key, and making sure that the correct information, the correct information about public health is for public good. So making sure that it's accessible to everybody, available in different languages, and all of that. And this is for me is the hardest thing, and that's what's missing. I think we're very proud with the work that we're doing in the region, because it's really kind of pioneering in terms of pathfinding for other regions as well. And we would like to make sure that this whole of society approach is actually implemented and not just as a slogan. So I think reaching out and collaborating and making sure that we are making all the information and resources available is key to the way as a way forward.
So there's a question that I think just came in. I think it's important we address that question, and which is, how do you gather misinformation presented in sign language? And you can also answer this question in context of other individuals with disability, people that cannot look at what they are, the videos, that they cannot even listen to the audio. So how is there any provision currently that addresses their need? Let's start with Lois.
Okay, I saw the question and I was amazed. Currently, there isn't like a provision for that, but it is an area we are looking into, because while we don't want any sector of the society or any group of people to be secluded, but currently there is nothing for sign language, like content for sign language, but it's something we are working towards to actually help our audience.
Halim.
As far as I know, unfortunately, there's nothing that I'm aware of, and that I think it's definitely important to consider, populations with disabilities. It's something that if the journalist who asked that question has any ideas for, we'd love to discuss it and see how can we collaborate on that. And definitely one of the things, as I mentioned, like the whole network approach and the making sure that this is an acknowledging and humbly approaching this this problem that is facing the entire world, not just us, is the best way to kind of bring our heads together, bring all the experts into one room and try to find solutions for it. And I think that having this network approach and having the making sure that we're able to cover as many populations as possible and making sure that the correct information is accessible is key. And yeah, I would just to end on that, to conclude here, and just if anybody has any ideas, let's go for it.
Thank you very much, Halim and Lois. And it's actually obvious that the discussions around tackling health misinformation is an unending one that we'll continue to have. There are still lots of burning questions that I would have loved to ask the two of you, but because the time has been fast spent, I wouldn't, I will not be able to take them. But on the general, on the overall, you've really been resourceful, and you've been able to address a lot of questions that we had. You've been able to also provide insights into the battle, into the fight against health misinformation in Africa. And I really want to appreciate it. So thank you very much for honoring our invitation. And I know that
Thank you, Paul.
we'll still be inviting you again to discuss about this issue, maybe from another context. I hope you'll be glad to still participate. Alan.
Oh, sure.
Absolutely. Thank you so much, Paul. And thank you to the whole ICJ team. Thank you so much.
Okay, yeah, so for our RCFJ forum, before we call it a day today, I would like to notify you that we have this conversation is still ongoing. Next week, we will be focusing on water insecurity during the pandemic and what it means for people that are living in poverty. And this next week's webinar is a partnership with water.org, and we'll be having their senior manager for insights and innovation. So we'll be looking at water-related issues in the context of the pandemic. And that's something that I would encourage you to still be part of. And so thanks so much for joining us today. And I hope this webinar helps inform you better on the topic of health, how the fight against health misinformation in Africa. And more importantly, for our journalists, I hope it helps inspire potential new angles for stories. And if you are not a member of the ICFJ Global Health Crisis Reporting Forum yet, I encourage you to please find the group on Facebook. Or for more information about the forum, go to www.icfj.org. If you would like to access journalism resources on COVID-19, please check out the International Journalist Network at www.ijnet.org. And please don't forget to fill out a survey coming to your inbox after this webinar. ICFJ would love your feedback to improve programming for this series. So thank you once again for taking out time out of a very busy schedule to join us today. And I hope you will be magnanimous enough to still join us next week and in our subsequent webinars. So from me, Paul Adepoju, the community manager for the ICFJ Global Health Crisis Reporting Forum, I say thank you, and we'll see you next week. So we are out in 5, 4, 3, 2, 1. Have a lovely day, guys.